Good evening, everybody. This is Dr. Kurt Woeller again. I appreciate you joining me tonight for this particular webinar. We're going to talk about oxytocin. We're going to first start talking about the issue with cholesterol, some interesting studies on cholesterol, talk about low cholesterol, linking it to oxytocin, then more specifics about oxytocin, and some updated information on oxytocin because it's an evolving story in medicine right now, particularly in autism, but other mental health disorders as well. So with that, let's go ahead and get started. I wanted to give everybody, for those of you who are healthcare practitioners, MD, DO, chiropractor, naturopath, nutritionist, whatever it is, we are now putting on one-day intensive seminars on the organic acids test from Great Plains. We just did one in Seattle last weekend, and our next one's coming up in December in Houston, Texas, and then also in February in San Diego, and there are more being scheduled as well. So if you want to learn how to incorporate the organic acids testing into your practice, understanding what the markers mean, how to clinically correlate the information, these are really great seminars for that. So you can just go to greatplainslaboratory.com. Okay, so as I mentioned tonight, we're going to talk about the functions of cholesterol, some problems when it's too high, and some problems when it's too low. Taking that information and looking at some research with some various health issues as well as mental health and autism, and then we're going to link the two, cholesterol and autism, excuse me, cholesterol and oxytocin, and then get more specific into the function of oxytocin and some dosing recommendations and some different ways of using it. Okay, so let's go ahead and get started. So some basic functions of cholesterol is it's a primary component of animal cell membranes. What it does is it helps provide structural integrity to the cell membranes, improving the membrane fluidity and permeability, allows the cell membranes to communicate with each other. It also helps the cell membranes and the cell itself to resist too many changes in the environment, particularly like with temperature. It makes up a large component of the myelin that protects nerve cells in the brain. Cholesterol is a precursor to steroid hormones, progesterone, testosterone, estrogen, and even cortisol. So individuals with poor adrenal function, low cholesterol may be a contributing factor. We need cholesterol to help produce bile. Bile is needed for the absorption of fat-soluble vitamins, vitamin A, D, E, and K, and it's involved in vitamin D conversion in the skin as well. So many of us in medicine and the general population knows about the risks when cholesterol is too high. It can be a risk factor for plaque buildup in the arteries, leading to coronary heart disease, carotid artery disease, peripheral artery disease. That's all pretty well known. I mean, that information's been out there for a long, long time. What hasn't been discussed very much, or at least the research been buried, is the risk factors for when cholesterol is low, particularly less than 160 milligrams per deciliter, or in Canada, and they also use these units over in Europe, 4.14 millimoles per liter. And there's an increase in cancer risk, increase in violent and aggressive behavior, increase in infectious diseases like tuberculosis. There is problems with, oh, come on. Okay, let's see if this is going to move. There it is. Increased anxiety and suicide, depression, bipolar, so mental health problems are prevalent when cholesterol becomes low. It's interesting, when you get too high cholesterol, there can be an increased risk for stroke. Well, when cholesterol is too low, it can also be an increased risk for stroke. In school-age children, increased rates of suspension when cholesterol is too low, and then also it's much more difficult to kick a drug addiction when cholesterol is too low as well. So if we take a look at cholesterol with respect to some information on the heart. And as I mentioned before, too high cholesterol can cause carotid artery disease, peripheral artery disease. But this was a research article that came out in 1998 in the Journal of Cardiology that was talking about that mortality was higher in individuals who had heart failure when their lipid levels, their blood levels, i.e. cholesterol, was much lower. So they're actually finding an increased risk or rate of mortality of people with heart failure who had lower levels of blood fats. Looks like my thing got one change here. Okay. Cholesterol is also very important for the immune system. As a matter of fact, in this particular article from the Western Price Foundation, they found that men with LDL cholesterol is the cholesterol that takes cholesterol from the liver, transports it out into the bloodstream. Those individuals who had cholesterol less than 160 milligrams per deciliter had significantly lower numbers of white blood cells than those when their cholesterol, or excuse me, their LDL cholesterol was higher. And we often talk about LDL cholesterol being the bad cholesterol, but it's the type of cholesterol that actually helps protect against infection, particularly Staphylococcus bacteria, which produces an endotoxin that can kill human red blood cells. So if we have poor LDL levels, we are at an increased risk for infectious problems, particularly bacterial issues like staph. Now, in this particular study in 1994, they were looking at children who had what was called adjustment disorders with depression, who tended to have issues with suicide or suicidal ideation. And of course, they found, as you would expect, that the lower levels of cholesterol, there was an increased problem in depression, an increased issue with suicidal ideation. And what was interesting here is that there was an inverse relationship that correlated as the lower the cholesterol levels were, the higher rate of substance abuse was found in these kids. This particular study in 1994 from the Journal of Clinical Psychiatry showed that in individuals who attempted suicide had much lower levels of cholesterol. Matter of fact, and that was really independent of age, of weight, of disease severity, of physical health. And so their findings were is that it can maybe implied that low cholesterol, suicide, and depression can be seen together. So the lower cholesterol, the greater the chance of mental health issues. We also talked about drug addiction, and this is just one research out of 2003 that was talking about cocaine addiction, that the lower levels of cholesterol that were found in cocaine addicts, the higher the rate of relapsing, either at 3 months, 6 months, or 12 months. Matter of fact, there is other studies that even correlate that with heroin addiction as well. So, low levels, if any of you have worked with individuals who are drug addicts or former drug addicts, it really is important to check total cholesterol levels. Well, school-age kids and the issues with violent behavior, aberrant behavior, and problems in school. And this was just one particular study in 2005 that was looking at a group of kids who had cholesterol concentrations in the lower 25th percentile, below 145 milligrams per deciliter, had a threefold increase of being more likely being suspended or expelled from schools than those kids who had higher cholesterol. One of the other things that comes up with cholesterol is there's an interesting link and relationship between cholesterol and serotonin function. In this particular example, they were looking at cholesterol levels in monkeys. And what they found was that monkeys that consumed a low cholesterol diet were more aggressive, they were less communicative, less interactive, less social, and actually had lower cerebrospinal fluid concentrations of serotonin, that feel-good neurochemical. They were measuring specifically this neurotransmitter metabolite called 5-HAA. And 5-HAA is actually something that can be looked at off of the organic acids test from Great Plains Laboratory. If you take a look here at number 32, 5-hydroxyindoleacetic acid, or 5-hydroxyindoleacetic. This is the byproduct of serotonin. Once serotonin has acted upon its postsynaptic receptor or postsynaptic serotonin receptor, and so you're basically picking up on this byproduct of serotonin metabolism. In about 90% of the organic acid tests that I see, the 5-HAA level is low normal. So it's underproduced, it's underfunctioning. Now, that could be because of dietary intake, that could be a poor conversion of tryptophan to serotonin, that could be a poor release of serotonin from its terminal vesicles where it's stored. So there's a lot of factors. But one of the things that starting to look at moving forward, is there a strong link between low serotonin and low cholesterol found on blood testing? At least that previous study indicated such. Time will tell if it sort of pans out from a testing standpoint with respects to the organic acids test. Well, it turns out that, too, that cholesterol has an effect on a specific receptor, the serotonin 1A receptor. And the 1A serotonin receptors play an important role in other organs of the body in mood, as you would expect, feel-good hormone, as you would expect, helps to decrease anxiety, helps to improve eating and healthy eating, helps to improve sleep, even regulates temperature, aggression is diminished, so low cholesterol interacting with serotonin. Now, this is a fascinating chart. This was a study that was done looking at countries around the world that had populations over 100,000, and they looked at what was called all-cause mortality. That was disease or deaths from infections, whether they're bacterial or parasitic, respiratory issues, maternal deaths, cancers, heart disease, degenerative disease, you name it. And what they found, and this was organized, by the way, through the World Health Organization, what they found was that the optimal cholesterol level in all of these countries throughout the world, in all diseases and mortality, the optimal level was 225 milligrams per deciliter, or 5.82 millimoles per liter in international units. Now, that is a lot higher than even what the American Cardiology Association here in the United States, or the AMA even states, with respect to what should be a healthy cholesterol, because most of the medications, the statin medications, are suppressing cholesterols very low. So that's what the World Health Organization data indicated as optimal. What we're looking for is to try to prevent, I guess you could say, disease in many respects by keeping cholesterols above 160. So, if you can look at a 170 to 180, perhaps even a 180 to 200, if you can make your target, if you are running low on cholesterol, even about 200, that may be, a reasonable target to take. But that 160 cutoff is really just to try to minimally prevent problems. So what are some potential causes of low cholesterol? Well, too much thyroid can do it, liver disease can do it, malabsorption of nutrients from the gut and malnutrition can do it. A lot of people don't think that gastrointestinal infections might cause a problem, but they tend to disrupt absorption and can create malnutrition. Manganese deficiency. So that's one of the things you can pick up off a hair test. And then there is a genetic disorder called SLOS. One of the reasons that I tend to do a lot of hair analysis in my practice is I want to be able to assess certain minerals. Now, this was just a hair analysis off an individual who had very low cholesterol. The lithium isn't so much correlated, but you do see a manganese that is suboptimal. Now, is manganese the sole reason for this individual's low cholesterol level? Probably not. But this individual actually had a total cholesterol and a lipid panel done. It was reported as normal from the conventional doctors, and that's what they know. But as you can see, cholesterol of 126 is extremely low. We're looking for minimally a level above 160. So this is an individual who is struggling to keep their cholesterol up and is struggling from a mental health standpoint as well. So what are some labs that can be done to at least assess for some potential problems of low cholesterol? Well, doing a standard blood test, liver panel, total proteins, liver function, etc., is worthwhile. Want to look at thyroid. I personally like to do a free T3, a free T4, and a TSH to get a much more better assessment of thyroid function. Essential fatty acid test, that is available from Great Plains. That's not something I do a lot, but it is an option if things are not turning around. The hair analysis is a great way to go because it's inexpensive and certainly gives some indication of mineral problems like manganese deficiency. Comprehensive digestive stool analysis, is there an infection? Is there inflammation? Is there something blocking absorption? And then, of course, the organic acid test from Great Plains that looks at different factors of yeast and bacteria, etc. Well, we're going to talk about a condition called SLOS. And in SLOS, there can be deformities in the feet. Matter of fact, this is sort of a classic picture here of a child with an SLOS problem where they have a fused third and fourth toe. They get this Y-shaped toe appearance. Now, Smith-Lemli-Opitz syndrome is essentially also called 7-dihydrocholesterol reductase deficiency. It is a genetic disorder where individuals may have an extremely difficult time producing natural cholesterol. And in some cases, cholesterols have been found all the way down to 0. If you test, they will generally tend to have high 7-dihydrocholesterol levels. In one study, over 3/4 of these individuals actually were on the autism spectrum, and they tend to have a crossover with autism. They can have a lack of speech. There can be behavioral problems. There could be aggression and violent outbursts. There could be self-mutilation. So some of those characteristics are seen in some of the kids, not all of them. The formation of cholesterol is important because there's a lot of cofactors that go into making cholesterol naturally in the body. We can see here that vitamin D is dependent on cholesterol. Here's where that defect takes place. That SLOS defect, there is a problem in converting 7-dihydrocholesterol to cholesterol. Now, we mentioned in some of these studies, cholesterol is important for bile salt formation to absorb fat-soluble vitamins. Okay? Cholesterol is important for steroid hormones, estrogen, testosterone, cortisol production. Cholesterol is important in the production of something called sonic hedgehog. Sonic hedgehog is a protein that is involved in helping the nervous system move nerve cells to a proper point of position so that you get a normal development of the nervous system. It also is involved in organizing information of the body to grow limbs and to make sure that you end up with 5 toes and not 8, or 5 toes and not 3. In this particular circumstance, the sonic hedgehog in the SLOS condition is problematic, which leads to the fusing of these 2 toes. When they look at cholesterol symptoms with respect to SLOS, when the cholesterol levels are lower, there is an increased severity in SLOS symptomatology, whether it's aggressive behavior, violent behavior, etc., language issues, and then, of course, the reverse would be true. If you do any kind of work with individuals with hormone imbalances, whether it's sex hormone imbalances of estrogen, progesterone, testosterone, adrenal hormone imbalances, pregnenolone, cortisol, you can see here at the top of the entry point here is that cholesterol is very important for feeding the production of pregnenolone. Pregnenolone is the master hormone that helps to sort of flow through these different pathways to keep everything in balance. So it's very difficult to get somebody's adrenal hormones turned around and in balance if they have low cholesterol. We talked earlier about cholesterol's effect at improving flexibility and pliability, if you will, in cells of the body. And this is exactly what this graph is showing, is that you've got cholesterol that embeds itself in between these phospholipid layers to create some flexibility, some pliability, so that things aren't so stiff and rigid. Matter of fact, about 70% of the myelin in the brain is made up of cholesterol. So cholesterol makes up a huge percentage of our brain weight, of the myelin that surrounds our nerve cells. Now, Great Plains has done its own internal studies on cholesterol levels. And what they found in a group of individuals was that most of them didn't have the extremely low cholesterol levels, below 100 down to 80, etc. The vast majority had cholesterols that were suboptimal, somewhere around 140 and on down. That's what I've seen in my practice. With most of the kids in my practice, the average cholesterol is about 120. I periodically see a 100 or 110. The lowest I've seen, I believe it was 65. So anyway, periodically I'll get a few kids that are normal. But the average is about 110 to 120 or so. Now, all of this is leading to documentation that has been supported not only in SLOS, but documentation that abnormalities of cholesterol metabolism can occur in autism spectrum disorders. Matter of fact, and the cutoff point of 160 really comes from the NIH, the National Institutes of Health meta-analysis correlating death rate, depression, anxiety, increased tendency to bipolar, violent behavior, Parkinson's disease, etc., seems to be much stronger when cholesterol levels are less than 160 milligrams per deciliter. So it's important to realize that it's not all just genetic, but there are many different types of health conditions that can be influenced negatively by cholesterol, not just autism, but a lot else. So what are some benefits when cholesterol is used in SLOS, which we may then correlate over with some other conditions? Well, what they found is what the list here shows. Improved coordination, improved growth, decreased head banging, improved tactile defensiveness, behavior improved. Some of the things, though, that I see commonly in my practice is that many of the parents report with their kids an improvement in alertness. They're much more social. Now, why would that be? I have a theory as to why this is happening with sociability we'll talk about here in a second. Talking in some people, particularly in adults, where they weren't talking before, has been seen. Decreased irritability. And then one of the things that was interesting about cholesterol when we first started doing it was many of the improvements were seen many times just within days of starting the therapy. And that usually doesn't make much sense when you're giving a supplement like this. But it does make sense if you start to understand how cholesterol can affect potentially something called the oxytocin receptors, which is what we'll get into here too shortly. And I think that also has to do why we can sometimes see increased sociability when cholesterol is used. Okay. So there are many different kinds of food source. Well, not many. There are some food source for cholesterol. The primary ones that most of us consume would be eggs. And one large egg is equivalent to about 250 milligrams of cholesterol. Brain is a good source. Don't know too many people that eat brain. Liver is a good source of cholesterol. But eggs are the primary source for most of us. The problem is that people have egg sensitivities, and so they can't eat eggs. Or some kids don't like eggs. Whether it's scrambled eggs, poached eggs, hard-boiled eggs, whatever, they won't eat them. So New Beginnings, a supplement company, had to come up with an alternative. And they found an excellent source of purified cholesterol, not of egg source, hypoallergenic to people who have egg allergies. That is a very good thing to help raise cholesterol level. One capsule is approximately 250 milligrams. So one capsule is about the same amount of cholesterol as a decent size egg. One of the things that we've launched is a website where the consumers can get certain lab tests to test themselves or their kids for hair testing, urine testing, organic acid testing, food sensitivity testing. We just added access to a total cholesterol, what's called a blood spot finger prick test, to look at total cholesterol levels. The website is labtestplus.com. So if this is something that you're interested in looking at, you can go to labtestplus.com and access you can actually order the total cholesterol test. And these test kits come to your home, you do them at home, and they're sent off. And then every particular test comes back with a written interpretation on what the findings are, and then action step suggestions on supplementation, etc. So that's labtestplus.com. So what are some general dosings for sonic cholesterol? And again, these are general. Okay, these are not etched in stone, and they may need to be adjusted over time. For cholesterols that are generally less than 100 milligrams per deciliter, the general recommendation start with about 4 to 6 capsules, probably lean more towards the 6 capsule side, per day, and divided doses with meals. So you figure if you're looking at getting above 160 or around 160 as your target, then the general recommendation is a capsule for every 10 points less than 160, approximately. Some people need more, some people need a little bit less. Moderate low cholesterol is 100 to 130, 3 to 4 capsules per day with divided meals, and then 2 capsules, 3 capsules above that, can be used as well. It's important to monitor blood levels, total cholesterol levels every 3-4 months, and then adjust accordingly. Great Plains has a very nice panel called the Advanced Cholesterol Profile. This is a blood test. It's not a finger prick test. Some individuals have low levels of apolipoprotein B, which helps to transport cholesterol through the body. That might be one reason that cholesterol levels are not coming up very much. The reality is there can be other mutation points in some of these converting enzymes too. So we don't know exactly in all circumstances why somebody may not be able to raise their cholesterol, particularly if you do your other tests and the manganese levels are fine, the thyroid levels are fine, the liver levels are fine. It just may be a conversion issue. One interesting thing that I've seen over the years, though, is that the levels don't always rise quickly when you're using sonic cholesterol, and sometimes it can take many, many months, but the effects of it can be seen very quickly. Parents reporting their kids are more calm, they're more sociable, they're better eye contact, they seem more adjusted, more comfortable in their environment, even after just a week. But we can't always totally rely on the blood levels to give us all the information. So the reality is the dosing recommendations I gave you, some people may need higher. Okay, let's talk about oxytocin here, and we'll kind of switch gears. I'll talk a little bit more about cholesterol, but when we look at oxytocin, there is a relationship. Oxytocin, some of its general functions is it helps with thinning of the cervix in preparation for delivery. It also helps in uterine contraction, so it's not only helping to thin the cervix, it's helping to contract the uterus so that the baby can be birthed. It's important in bonding between mother and child during breastfeeding as well as milk letdown. It increases feelings of trust, pleasure, and harmony. It's been used as a therapy for people with anxiety, particularly social anxiety. The interesting thing about oxytocin as well, something that's more strongly correlated in the autism community, is that it's important for brain development with respect to facial and voice emotional recognition and, again, social bonding. Now, social bonding is interesting because it tends to, oxytocin, increase meaningful social interactions, such as, between new couples, or it increases the desire for or the intensity of sexual relations. People often, when their oxytocin levels are higher, are more interested in making new friends or meeting new people, being involved in new social situations. They've actually correlated improvement in feeling camaraderie with others, positive social interactions in business relationships, friendships, playing sports, even witnessing sports. So, sports teams in a stadium or an arena, when the home team has done well and the fans are cheering, can be an effect of improving oxytocin in the collective audience. Military camaraderie is something known and important as far as a social bonding standpoint. Now, I had mentioned before an interesting study about the link between cholesterol and serotonin. Well, it turns out that oxytocin also has a link to serotonin. This was just a particular paper in a European Neuropsychopharmacology journal in August of 2012, talking about some of the effects of some of the serotonin reuptake inhibitors, these SSRI medications. They certainly know that they help to improve serotonin metabolism, but in part, they also seem to have an effect at improving the functionality of oxytocin. So it may be that we're not just getting an effect of just serotonin, but the oxytocin system is improved. And this is what the overview really indicated, was that functional interaction between the serotonergic and the oxygenergic systems. Matter of fact, they were particularly looking at two medications, Celexa and Luvox. So there's an overlap here, and I think that's an important distinction to know about. Well, what are some suspected ways of naturally increasing oxytocin? We don't always want to be reliant on a drug. Well, giving and getting hugs, that physical contact is known to trigger oxytocin. Positive mental focusing on others, thinking positively about loving somebody else. Pets. We all know that we feel good, many of us, with our pets, whether it's our horse or a dog or a cat. But physical contact with pets is known to increase oxytocin levels. Using social media in a positive way. Excitement, going to an amusement park, something that raises the adrenaline level a bit. That moderately stressful activity can help to raise people's oxytocin levels. Eating and sharing a good meal. The ingestion of food often triggers the release of what are called vagal afferent nerves. These are the nerves that get transported from the vagus nerve, from the digestive system. And of course, doing that in a socially positive way will help to increase oxytocin. Listening with your eyes, eye contact is critically important, particularly when you're conversing with another individual. That is known to activate oxytocin. And then doing service as well. Well, it turns out that oxytocin as a therapy can also be used in grief. Matter of fact, it's not just something to help decrease anxiety, increase bonding, but it's been shown to help individuals in grief. And this is a particular book. It's a free ebook that you can get at griefsos.com, and it was written by Dr. Stoller, who, and this is all information off the internet, who had lost his son in an accident, car accident, at a young age. And he talks about the fact of the tremendous grief that he felt, like any parent would, and that the oxytocin didn't necessarily take the memory away. What it did is it took away the fear and the anxiety of that deep-seated, I want to say depression, but that deep-seated anxiety that would come up, particularly in the middle of the night. So an interesting way of using oxytocin. And so if that is an issue that you've had to deal with, then I would encourage you to go to griefsos.com. So oxytocin has a lot of different interactions with the body. We know that it can interact with serotonin. We also know that it can be involved in what's called the cholinergic system, that part of the autonomic nervous system in the body, which can help regulate stress. It turns out that oxytocin can have an effect on glucocorticoids, and that's primarily the adrenal system of the body, the hypothalamic pituitary adrenal axis, which controls cortisol production, can be influenced in a way by oxytocin. Over here, the alpha-2 receptor function, this is where oxytocin can have an effect on the cardiovascular system, and in part also may help with some of those issues of anxiety. Some of the medications that are given to kids on the autism spectrum with respect to anxiety, stress, aggressive behavior, impulsivity, regulate these alpha-2 receptors in the central nervous system. This is an interesting slide, and let me just kind of explain this to you real quickly here. This is kind of just showing that oxytocin receptors are really found throughout the body. And the vagus nerve is this large nerve that connects our brain to our gut, and it also has nerves that transport out into our skin and are strategically placed throughout our body. About 80% of vagal nerve activity is what's called afferent, which means it's bringing information from outward of our body, so from our gut, from our skin, and it's bringing it into the nervous system. So about 80% of all nerve activity, the vagus nerve, is afferent. Well, here you see the ventral side of the abdomen, the urogenital organs, the gastrointestinal tract, all feed in without being transported, by the way, to the spinal column. They feed directly into this, what's called ganglion nodosum. This ganglion nodosum sits right at about the junction of the first cervical vertebrae. That's kind of the area that it's in, probably more up internal inside the occiput of the brain, but it's in that critical area. And you can imagine what happens, and I've seen this over time in some people who get whiplash injuries. They injure the occiput, or they injure the atlas and the axis area, the first and second cervical vertebrae, and over time they tend to develop a lot of issues with depression, with anxiety. That's not to say it's the sole reason, but if this ganglion were influenced that way, it certainly could be a problem. And then it transports it into the brain, and then takes this nucleus tract of solitarius, it's called, and this moves it into the paraventricular nucleus. This particular area here is right up in the areas of the limbic system, and the limbic system is very much involved in emotional control, emotional memory, and so it's an important area which we'll talk about here shortly. The reason I bring this up is you notice these nerve fibers that come off the abdomen. It also comes off the chest. And so why do you think that hugging somebody and having physical contact with somebody via hugging, when you're basically hugging somebody chest to chest and abdomen to abdomen, can help to raise oxytocin levels? Well, one of the reasons is that you're basically activating these vagal afferent nerves in the chest, in the abdomen area, and they're being transported into the brain and releasing oxytocin. The same type of thing here, the gastrointestinal tract. When you eat food and that food has a very pleasant taste, or a very gives that pleasant feeling, you're getting oxytocin release because the vagal afferent nerves are taking that information back into the nervous system. Oxytocin is also released in sexual activity and sexual stimulus, coming off the urogenital organs, which makes perfect sense as well. An interesting program I was watching the other night was on dogs. And they were talking about the research into animals, particularly in this particular case, was dogs. And do dogs, are they just sort of fooling you, when you come home and they're wagging their tail, and do they just want a treat? Or do they actually feel some kind of relationship with you? And what they found was that dogs certainly do have that relationship, that feel-good relationship with their owner. Matter of fact, when you pet an animal, particularly a dog in this particular case, they're getting a release of oxytocin. You as an owner are also getting a release of oxytocin as well from that petting. If you think about a dog that likes to lie on its side and have its abdomen rubbed or its chest rubbed, the same types of things are happening in the dog that are happening with us, is those vagal afferent nerves are being activated. But what was real interesting was the authors of this study were talking about eye contact. When a dog is having an eye contact with you as its owner, it is, in essence, is giving you a hug. And that mutual relationship you have with eye contact is causing a release of oxytocin. So if you have a dog, love them, pet them, look them in the eye, tell them they're a good boy and girl, and you're both going to get a mutual release of oxytocin. This particular dog is our dog, Sierra, a white lab, and she's an absolute joy, and she's just always happy. Okay, what is the relationship between oxytocin and cholesterol? Well, it turns out that we know that, as I mentioned before, cholesterol can have an influence on serotonin levels. Oxytocin can have an influence on serotonin levels. Well, a long time ago when I was looking at this research, or even before I was looking at the research, I often wondered why were some of the kids I was giving cholesterol to getting improvements in sociability, calmness, less irritability, sometimes just within the first week of giving sonic cholesterol. And so I wondered if somehow cholesterol was having an effect on oxytocin. Well, it turns out there's a lot of research behind this, that one of the effects of cholesterol is that it improves the binding of oxytocin at the oxytocin receptor, and it improves the stability of the oxytocin receptor as well. In fact, what they have found is that oxytocin receptors across the board function better and basically are prevented from losing function when they have enough cholesterol in the area stabilizing them. And so realize that maybe, and I can't prove 100%, but maybe in part what was happening, or it still is, with individuals who are getting benefit of sonic cholesterol therapy in the early stages isn't so much because their blood levels are changing, it's because they're getting an improvement in central nervous system function, oxytocin receptor function via cholesterol. Well, let's shift gears and just talk about oxytocin and autism here for a second. We know that in autism there is key areas of problems. There's social issues, there's language and communication problems, and there's behavioral problems. We're going to focus on the social end here. So when oxytocin is impaired, many times there is impairment of facial recognition, social cue recognition. We see that quite a bit with kids. Coping skills can become difficult. Many times anxiety and aggression, poor social interaction, bonding is less, and then many times with that anxiety comes the ritualistic and repetitive behavior. In some individuals, and this is just a study out of Japan, it may be that in part the oxytocin receptors are affected. And the cholesterol is normal, it's hard to say. But so you could have an oxytocin receptor mutation that just causes the receptor to not bind effectively to the oxytocin that's being produced. And this was one study that was just kind of highlighting that, looking at a Japanese population. So it could be that we've got mutation points in oxytocin receptors. If we look at a normal brain and then we sort of correlate that with what's going on in autism, we know that in autistic individuals, the frontal lobe tends to be compromised, and that can involve their ability to plan and function appropriately. Cerebellum is often compromised, and so motor skills, proprioception, attention to task is often compromised. And then we really get into the areas like the temporal lobe, which affects speech and language centers, the hippocampus and amygdala, which are involved in memory and emotion, are compromised. If we focus on the areas that are involved in facial recognition, we can see that these are quite common in autism as well. Matter of fact, if you were to take the brain and cut it in half, and you were to look down near the bottom end of the brain, you'll notice right inside the temporal lobe, the temporal lobe is where your ears are situated, is an area called the fusiform gyrus. And the fusiform gyrus is an area that is involved in recognizing faces. Matter of fact, they've done some MRI studies and looked at metabolic activity in the brain of healthy, or what we call neurotypical individuals, and then individuals with autism. And they find that both areas light up in both groups, but the area in red in the neurotypical individual generally is much more active with respects to face perception, whereas the blue is much more active with respects to non-face objects. There was a research article in 2004 called "The Brain Responds to Personally Familiar Faces in Autism," and they were correlating activity that was occurring in the fusiform gyrus. And what they found was that autistic individuals showed greater fusiform activity with respects to familiar faces versus strangers' faces. So there seems to be a learned pattern where they tend to recognize people that they're familiar of much more than strangers, at least being able to pick up on the subtleties of their face, their eyes, their nose, the patterning of their face, expressions that these people give off. Well, I often wondered then, okay, the fusiform gyrus seems to be linked to facial expression recognition. Is it possible that oxytocin may be influencing that particular area? And sure enough, there's some interesting research, this is in Neuroscience 2008, that talked about the fact that oxytocin modulates the expression of what's called evaluative conditioning for socially relevant faces via its influence on the fusiform gyrus. And that may be in part why you get a pro-social effect with oxytocin use in autism. You don't have it happen 100% of the time, and I know there's kids out there who haven't got benefit from it, but there clearly is a link to how it works physiologically. Well, in 2000, this article was in 2012, there was an interesting paper called "Promoting Social Behavior with Oxytocin in High Functioning Autism Spectrum Disorders," and they actually took 13 individuals with autism, and they tested their effects on and off oxytocin use. And what they found, sort of in general, is here highlighted in bold. There was a reported enhanced feelings of trust and preference when these people were engaged with others. They had an improvement in gaze time, specifically at informative regions of the face, namely the eyes, and that's critically important because think about your dog, think about all of us with respects to eye contact and how important that is from a social standpoint. In fact, what they did was they were using a particular form of oxytocin, an oxytocin spray from a pharmaceutical company called Novartis, and they were using a total dose of 24 international units. And across the board, they found that there was an improvement in detection of gaze, looking at the face versus outside or other areas, looking specifically at the eyes of an individual as opposed to looking at their forehead and cheeks. Increased eye contact was improved with oxytocin. Well, in 2013, another interesting article was talking about some of the effects that oxytocin has on brain speed, on memory formation, and specifically dealing with the hippocampus, which is very much involved in emotional stimuli, emotional control, and memory. And so the way this breaks down is the hippocampus, we'll show a picture of that here in a second, has a number of nerve cells. Some are called interneurons and pyramidal neurons. And what these things do is think of them as filters. So in order to get something past these neurons, they've got to be important enough. It's got to be powerful enough to create a real stimulus versus just a bunch of irrelevant static. And in order for something to become concrete. So the pyramidal and the interneurons act as filters. They basically sort of block out some of that erratic, static information from the environment. So a real signal to get through to create a real memory. And what the research team found is when oxytocin levels were high, the inner neurons had more of a filtering effect. So it took a stronger signal to get something permanent and concrete. And that's important because if you take oxytocin away, then the filter's turned off and you just get a bunch of nonsense filtering through. So nothing really gets permanent, imprinted, or too much stuff gets imprinted that's not important. So the balance of power between the inner neurons and the pyramidal neurons is critically important to help the brain fine-tune information, sort of what's important to retain and what isn't. Well, it turns out that autistics tend to focus more on visual and spatial details while ignoring that big picture. They tend to not see the big picture approach. So I'm going to bring up an image here. I want you to, as you see this thing come up, I want you just to, in your mind's eye, think about what you see first. Okay? So what did I see when I first read this article? I saw a W. Then my eyes recognized that the W was made out of A's. And probably you found the same thing as well. Well, it turns out that autistic individuals, when you do that kind of study, will typically spot the A's. Matter of fact, they will focus in on this A here, or they might come and see that A. And they get hyper-focused on the A's, but they don't see the W unless it's pointed out to them. It's not inherently obvious. So they lose the big picture and get hyper-focused on just a small detail. And this certainly becomes problematic in social situations where you're trying to talk to somebody or in a crowded room or not quite being able to pick up on facial expressions or the tone of somebody's voice. And you can see where that might create a problem from anxiety and for some are higher functioning individuals where they just flat out avoid certain circumstances. Okay. So the article is really talking about that autism is linked to both lower oxytocin levels as well as potentially mutations in the oxytocin receptors. And that we have to have these pyramidal interneuron filters that just make it where you've got to have real important information get through, not just a bunch of static. Okay? So, all right. So that tends to make sense. I think that certainly is true with a lot of individuals on the spectrum that we work with. Well, what about this aspect of the love hormone? You know, oxytocin is talked about as far as a love hormone. Well, it turns out in some people it doesn't work. Or it may be that we haven't found the right form or the right dose. That oxytocin may actually trigger anxiety and fear. There was an interesting mouse study done at Northwestern University where they took 3 groups of mice. One group of mice was missing oxytocin receptors. Another group had increased oxytocin receptors, and the other group had normal amount. They took all 3 groups, exposed them to a community of really aggressive mice, left them in there for a while. And then they took the mice out, let them get acclimated to their new environment. And then about 6 hours later, they took each individual group and plopped them back into this aggressive mice community and watched what happened. Well, the results were interesting. The mice that were missing oxytocin receptors just didn't really seem to remember that they had been exposed to the aggressive mice before. They just didn't, nothing was going on. Those with increased receptors tended to show an increased avoidance behavior around the aggressive mice. Those with normal oxytocin receptors kind of had what you would expect. Some avoidance, but not complete avoidance, but not being completely oblivious either. So what the authors found was that oxytocin may actually enhance fear and anxiety in future stressful events in some individuals, i.e. some mice. And that oxytocin seems to strengthen social memory, in particular one part of the brain called the lateral septum, which is involved in stress and emotions. Well, the lateral septum makes up this area here where we see the cingulate gyrus and the amygdala and the hippocampus. That's kind of the general vicinity of the lateral septum. And the limbic system is important because the limbic system is very much involved in memory, particularly emotional memory, whether it's visual memory, tactile memory, auditory memory, olfactory memory. A couple of areas within the limbic system that are important. The hippocampus is part of the limbic system along with what's called the amygdala and the thalamus. It helps to consolidate short to long-term memory as well as sort of spatial orientation of the brain. It's definitely involved in emotional support, particularly emotional memory or olfaction recognition, how we know that smells can activate certain memories of the past. You can start to have problems in the hippocampus that can be an issue. They certainly know that the Alzheimer's disease tends to have problems in the hippocampus. And so memory disorders can manifest as well as emotional instability. Well, the amygdala is also part of the limbic system. This is actually found within the temporal lobe, areas where the fusiform gyrus is located. And its primary role is in processing memory of emotions too. And it then sends impulses out to various parts of the brain. It can be involved when it's damaged or dysfunctional, fear conditioning, as well as emotional learning. So you can see how there's a lot of stuff being tied into emotional issues here. It's interesting, when amygdala is damaged, there are social interaction problems, particularly personal space issues, where people don't recognize that personal space distance, something that I've seen with some kids on the spectrum over time, not all. So what they talked about in this article, and why it's important, is that one other factor in oxytocin is something called extracellular regulated kinases, or ERKs. These are signaling molecules that seem to increase the brain's response to fear, particularly from past negative experiences. So it may, in some individuals, and unfortunately we don't know, we can't test, but in some individuals, when you may get with oxytocin an increase in fear response, sometimes an increase in anxiety. And I've seen this with a few patients and a few kids. Is it the ERKs? Maybe. It could be that's what's happening. But what they found in these mice anyway was that oxytocin tended to increase these ERK activities, and so when these mice were put back into the environment of aggressive mice, they had a heightened response because it was like the memory was so intense. So oxytocin can have a dual effect, and really the therapy needs to be monitored clinically with every patient over time to optimize results, but the reality is the story of oxytocin is unfolding and not completely concrete with every particular person. So it has to be implemented and tried, and sometimes the only way to know if oxytocin is going to be a benefit is to give it a trial treatment to see if it works. Now, through Lab Test Plus, we actually have made available a 24-hour urine oxytocin test. It comes from it's a way of testing for the peaks and valleys of oxytocin over a 24-hour period of time, and this can be useful as a way to look at oxytocin levels in an individual to see if it's appropriate, if it's always running at a deficit, and maybe give some predictive aspects of is it going to be more useful in this particular individual. You still may not know what the overall outcome is going to be until you try it, but it's an interesting test to look at to see if oxytocin is even being produced, throughout the whole body at a normal level. And so again, that can be accessed at labtestplus.com. So let's wrap up and talk about some different options for oxytocin use. It comes in a number of different forms. You can get it as a nasal spray, oral. It can be made from compounding pharmacies as either a sublingual tablet or liquid. And then there's transdermal option too. There are a wide variety of pharmacies throughout the United States that can compound oxytocin in a number of different forms. These are the ones that I've commonly used. There are probably many others. So you can see here there's some pharmacy in New Jersey and California. Anyway, they're throughout the U.S. Well, it turns out what's interesting about compounded oxytocin is this particular nasal spray that was used in that study that was looking at improvement in gaze time and fixation on eye contact in oxytocin was using this particular nasal spray from that company called Novartis. And there is a new company called Retrophin that acquired the exclusive rights from Novartis to reproduce nasal oxytocin. Now, oxytocin was taken off the market nasally in 1997 for commercial reasons, but it's always been approved from the FDA since 1960 for postpartum milk ejection. So it's been around a long time, it just hasn't been available. So Retrophin's plan is to relaunch and resupply the Syntocinon oxytocin nasal spray. And they're currently doing a trial for autism as well as schizophrenia, and they're looking to add other types of conditions as well. Now, it can be compounded, so 10 unit, 40 unit, 80 unit per ml nasal spray concentration, usually 1 to 2 sprays once to twice daily as needed. Unfortunately, with oxytocin, the way it stands now, is that there's not an exact amount per age or weight been determined, so it's sort of an average. If we looked at the studies that were put on using the Syntocinon nasal spray, they were using a 24-unit dose. The original concentration of the Retrophin was 40 units per ml, or 4 units per spray. Okay, so I think if you're in the ballpark, essentially, 24 units, 30, 36 units, maybe a little bit higher wherever, that's fine. I will typically start people with a 20 unit per ml concentration and then do 1 to 2 sprays each nostril once. Usually start off once daily and then maybe go to twice daily. Everybody's going to be a little bit different. And at times I've gone up on concentration. But that's not a bad place to start, just with a 20 unit per ml concentration. These were just some slides that we're talking about the upcoming, or currently, as a matter of fact, they're going on now, studies at the University of California, San Diego, from Retrophin in using intranasal oxytocin. This one in particular is schizophrenia, and this is another study that they're involved in the use in autism. And really what they're hoping to do is come up with some really concrete information that takes away the guessing game and helps us understand in what types of individuals it's going to be most successful in, and really help practitioners to fine-tune how much to use. So that's going to be certainly useful information, but that information is still in the works. That doesn't mean you can't get oxytocin now, because you can, and just try it and see what effects you may get. So general dosing suggestions for oxytocin, anywhere between 10 to 40 units per ml, 1 to 3 sprays daily on average. A common starting dose, again, is about 20 units per ml. These were just some general suggested dosings from one of the pharmacies. Again, it's not etched in stone. It's not specific for age or weight. It's just general recommendations. And so myself, I tend to be conservative in the beginning and then ramp up dosing over time. I like to see how somebody's going to respond. When you're dealing with autism, these individuals are much more sensitive, so you need to start slower and slower. An individual with generalized anxiety could probably handle more. These things have been used to enhance feelings of sexual interest in relations, with mutual couples, and in a consensual way, that it can be useful that way as well. So, usually in autism, again, I'll start with 1 dose each nostril once a day, and then ramp it up from there. sometimes the nasal sprays seem to get metabolized very quickly. So they can have an initial effect within 15, 20 minutes and then tend to wear off over a couple hours. So they sometimes need more frequent dosing. And that's where we've used something like the sublingual tablets or the oral liquid. We'll talk about that in a second. Some observations with oxytocin, as you would expect: improvement in socialization interest, decreased repetitive behaviors in those people who have that, improved anxiety, more calm in adults, some improvement in height and sexual interest. With the nasal spray, the onset is pretty quick, sometimes 15 to 20 minutes, so it can be used in some individuals kind of as an as-needed dose before a socially stressful situation, perhaps. Some downside with nasal sprays is it's difficult to figure out the optimal dose, particularly with individuals on the spectrum. It just is. It's generally more difficult for some kids to do. Some little kids don't like the nasal sprays, which can make it a bit of a challenge. I've had a few individuals and adults get some rebound headache with the nasal spray. You know, that's not real serious, but anyway, something to watch for. Erratic results, like a lot of things in some individuals. It's very individualized. And again, kind of like that rat study that was talking about those ERKs being produced, I have seen a few individuals where they just felt more anxious with oxytocin. Well, oral tablets and sublingual tablets. I don't tend to use oral tablets too much. I tend to use the sublingual tablets or the liquid more just with my patient population. The oral tablets are going to have a slower absorption. I tend to go either for the nasal spray or the sublingual. And, 5 to 10 units per dose, and then kind of ramp it up from there. One interesting thing about using the tablets and the spray that I've seen, I've had a few individuals, kids, the autistic kids, where I put them on a couple tablets a day to sort of get a baseline steady level in the body, and then layer in a nasal spray in times of a stressful event. So there's sort of a steady level being maintained with the tablet or the liquid, the oral liquid. It's a sublingual liquid. And then add in a nasal spray if there is let's say, a particularly stressful situation, going to the mall or going to the grocery store or going to the doctor's, whatever it may be. So that can be one way of using it. And certainly it's not a problem to just start off with the liquid or the tablets and see what you get, and sometimes that alone is enough. This is something I'm starting to do more, and that is looking at a homeopathic preparation of oxytocin. I had a doctor who's he feels like he's seeing really good results with homeopathic oxytocin, and this is a nice option for people who may not have a doc who can prescribe oxytocin or who is unwilling to. This particular link I'm leaving right here, you can access this website. In fact, you can just go into your browser and type in homeopathic oxytocin, or go to elixirs.com and do a search for homeopathic oxytocin, and this will come up. Homeopathics are very, very, very low potency remedies that generally tend to have an effect on the frequency of something in the body. So it's not like you're taking a large dose of oxytocin this way. This isn't something that is needed via prescription. It essentially is sold as a supplement. Maybe a worthwhile place to start, particularly in kids. If you want to look at trying some oxytocin, the general suggested dose is about 3 pellets taken at one time and repeated once daily. So, in my experience with homeopathics is, they're not toxic, and sometimes they can be very helpful. Sometimes they don't work at all. But the reality is sometimes the oxytocin prescriptions don't work either. So it's just an option for you from that respect. Okay, so that is my presentation tonight. For those of you who either have a child with autism or work with autistic individuals, I am always available for questions and answers through autismactionplan.com. This is a subscription website. It's $37 a month. There's no long-term contracts. You can, turn off your PayPal whenever you want. But there is a very informative parent forum that people post questions to me. There is a private messaging section as part of this website. I answer questions on a daily basis, weekends, holidays as well. If you want to have a dialogue, if you want some more information, if you would like to troubleshoot something, if you want me to look at a supplement, whatever it may be. There's also videos, articles, etc. on Autism Action Plan. If you're interested in doing some other types of integrative medicine testing, either on yourself or with your child, then I encourage you to go to labtestplus.com. We highlight a number of different labs, Great Plains being one of them as far as hair testing, amino acid testing, organic acids testing, food sensitivity. You can access lab tests through here, and each lab is reviewed by me with a special individualized written interpretation that comes with that as well. Also, if you're not sure what type of lab you'd want to order, or you've got some questions about it, you can go to labtestplus.com and go into the which test section and submit your question there, and we'll respond. We'll say, hey, look at these, or here's some recommendations, just to give you some more information. And then finally, if you came on late, if you are a healthcare practitioner, MD, DO, chiropractor, acupuncturist, nutritionist, naturopath, whatever, I encourage you to join us at one of the organic acid testing training seminars, these one-day intensives. We just did one in Seattle. There's another one coming up in Houston, December, February in San Diego, and there's more scheduled after that. So you can go to GreatPlainsLaboratory.com. If you happen to post some questions for tonight's webinar, Great Plains will send those to me. I will respond via email. There's so much information we go through that there's just not enough time to go through all the questions. But if you happen to submit those will be sent to me on email generally later this week, and then I'll respond to those in kind. So everybody, I hope this was useful information for you tonight. We will see you next time, and take care and be well.